That is one of the ground rules. All right, welcome to U.S. Coast Guard Licensing and Mariners Mental Health. I'm Elizabeth McNee, Associate Professor at Cal Maritime in the Department of Marine Transportation. Just a quick set of ground rules. We are recording this event. So if you prefer to remain anonymous, you can change your name to student or faculty. That way, when we also have questions and answers that you post in chat, you can ask them anonymously if you like. Also, remember to stay on mute, and we will read your questions in the chat later on. Mental health is a big problem at Cal Maritime and throughout the maritime community. We have great services here on campus that may go underutilized by some folks who believe that coming forward with, reaching out for some help when you're feeling depressed or have anxiety may adversely affect your ability to get a U.S. Coast Guard license. And so we were prompted by that problem to invite our guest today to talk to us. And that is Dr. Laura Torres-Reyes. And she is the, let me read her bio. She is the Medical Evaluation Division Chief at the U.S. Coast Guard National Maritime Center in Martinsburg, West Virginia. Dr. Torres-Reyes joined the National Maritime Center in June of 2016 after retiring from a 34-year distinguished career in the U.S. Air Force. She is a combat veteran with over 20 years of command experience and 460 flighting hours as a rated flight surgeon. She received her Bachelor of Science at Cornell University, earned her medical degree from Howard University College of Medicine, and her Master's of Public Health and Residency in Occupational and Environmental Medicine from Johns Hopkins University. She is a fellow of the American College of Occupational and Environmental Medicine with over 30 years of clinical and executive experience evaluating safety and fitness for duty in the aerospace industry and fitness for evaluation in the maritime industry. So I am really pleased to have Dr. Torres-Reyes here today. She prefers to go by Dr. TR, so that's how we're gonna do it today. So Dr. TR, with that, I'd like to turn over the discussion to you. And I know you have some PowerPoints that you'd like to share with us. So I'll turn it over to you at this time.
Okay, well, thank you so much. I just want to really thank you, Dr. McNee, for inviting me for this. Can you hear me okay?
Yes, we can.
Good, okay. So we're gonna get started with the slides, and as the slides are coming on board, I just want all of you, first of all, to hopefully take away from this how important it is to take care of mental health issues. The Coast Guard wants you to be a merchant mariner, and you will see from our slides that it is very easy to do so as long as you really take care of yourself. And if you have issues, don't be afraid to report them and get treatment. That's really the bottom line. If you get treatment, you should have a long and healthy career with the merchant mariners. So let's get started with our video here, our PowerPoint slides. Now, right now, what do I need to do? Because I don't see, I just see Avita Adriano's name on my slide. Do I need to share my screen or no? You're sharing your screen?
Am I showing my screen? I'm sorry.
No, so I don't see the slides. Are the slides up, Dr. McNee?
I don't see any slide. I'm sorry.
Okay. So.
Dr. McNee, you're muted. Sorry.
There we go.
There it is.
Yes. Okay. All right. So this is just the title slide. We've already gone through that. The next slide is very important because it shows what's called the Merchant Mariner Medical Manual. You'll notice the date on this. It's really new, August 2019. So the old guidance was called the NAVIC 0408. This is the new guidance, which I think is more user-friendly. And the bottom line is it's very open and critical for you to look at if you have any questions. It really clarifies what the Coast Guard is looking for. And that's where we're going to go through some slides, and we'll give you the chapter. So hopefully this slide presentation will be a reference for you. If after all this, after questions, you have any more questions, don't hesitate. Don't hesitate to look at this slide of the Merchant Mariner medication.
It was.
Next, please. Somebody's not on mute. Okay, next slide, please.
I'm not really paying attention to it, but
You're totally fine.
I just think
Yeah. I appreciate that.
Okay, somebody's not on mute. We can hear your conversation.
Yes, everybody, please mute your microphone. We can hear
Let
you.
me grab another bolster to kind of put your legs under. Just need to keep your eye up. Be right back.
Okay. So you'll see here, this is the chapter in the Commandant Instruction Manual that refers to psychiatric or mental health conditions. And you'll see that what the Coast Guard is looking at when you put on your application, your 719K, these are the conditions that will require additional information. So if you have any of these conditions, no problem, but you just need to understand that we're going to ask for some more information. What we're looking for, what the Coast Guard is looking for, are conditions that are associated with significant functional impairment, require medication that impairs cognitive ability, judgment, or reaction time, or that pose significant risk of sudden incapacitation or debilitating complications. Obviously, the most frequent conditions that can be considered for these are mood and anxiety disorders, schizophrenia, psychotic disorders, and alcohol substance abuse disorders. Next, please. The good news is that in the end, if you provide the correct information and you have a practitioner who's supportive of you, that the Coast Guard can recommend certification. So we're not saying it's disqualifying. We're saying that if the condition is asymptomatic, without recent need for major intervention, hospitalization to surgery, or if the condition has been stable, low likelihood of sudden exacerbation or complications, or if there is no history of or risk for psychosis, suicidal ideation, or homicidal ideation, and there is no risk of impaired cognitive ability, judgment, or reaction time related to the condition or associated medications, and if documentation supports the applicant has functional capacity and physical abilities necessary to perform routine and emergency duties, then it is likely that you would either get a waiver or get full certification without the requirement for a waiver. Next, please. I'm sorry, the transitions are kind of slow, though. I got to take those out. So it's important for you, the mariner, when you go to your provider with your 719K application and you mention that you have these certain psychiatric or mental health conditions, make sure that you discuss with your provider and make sure that they understand that they need to specify that your mental health condition and the limitations of medical care aboard the vessel. If there are no limitations, they should state that on the 719K or in a separate note that you will attach with your 719K when you submit it. The key words are, they need to understand that you have a safety sensitive position and the nature of your merchant mariner is a safety sensitive position. They need to understand or may affect your service aboard a vessel. So the key things here you're seeing is that we need to see that your provider who's saying, yep, this person is good to go, understands what you're going to be doing as a merchant mariner. It is also recommended that the treating provider performing your certificate examination review the guidance in the manual. So actually, easy peasy, if you took these slides and said, hey doc, this is what the Coast Guard is looking for, if you can address these, that's as easy as it gets. If the letter addresses these issues, then it's very likely that you will have a waiver or again, even a medical certification without requiring a waiver if the documentation is really good. Next, please.
oh, you're in it.
Okay, so this is where the guidance is for us at the National Maritime Center. We have physician assistants who review the applications and require certification without a waiver. What we're looking at, again, that written assessment from your treating provider is critical. And they need to address exactly the condition, the medications, discuss how much of a risk is it for functional impairment, if your condition is stable, that it's low likelihood for worsening or recurrence, and that you're good with your treatment compliance and efficacy. It also is clear that they make it clear that they understand that you are a merchant mariner in a safety-sensitive position that will be having austere, possibly austere conditions on board a vessel or at sea. Next, please. Okay. So once you provide all the information and your doctor has submitted the letter of recommendation of that you go, or how stable you are, then sometimes if we don't get all the information we need, we may ask you, we'll send you what is called an AI letter, additional information letter, that may ask you to have more information from your psychiatrist or treating provider. Or in some instances, if you have a substance abuse condition, we will ask for a substance abuse professional, a letter from a substance abuse professional to attest to your stability and your that you have gone through proper training. Can you hear me? Are you guys can't hear me? Okay. And then last but not least, there's something called neuropsychological neurocognitive testing. That testing is cost to ask that because we understand that your ability necessarily to pay or to have that kind of testing it may be limited. So don't worry about that. We'll work with you. If we ask you for something that you feel like you really can't do, then we'll work with you. Again, our goal is to have you as a productive and healthy mariner in the Coast Guard. Next, please. Okay, so that's the down and dirty. Those are the facts. That's the guidance that we have that you now have access to. And what we need from you, really, the rest of the floor is to you. You'll see on this slide at the bottom, there's all sorts of ways to contact us. Even if you send any a message to any of these places and say, hey, I just want to talk to Dr. Torres Reyes, they will get you access to me directly and we can talk. And we can work out whatever we can to make you sail safely and make sure that you're taken care of. All right, the floor is open to all of you.
Well, thank you so much, Dr. TR. I really appreciate it. I want to say also that you did send us additional information that we can make available through the Counseling and Psychological Center, and that will have all of this contact information on there.
Excellent.
So with that, I just want to stop sharing and see if we have any questions. Or actually, I want to start with just a couple of clarifying questions. So if I can sort of summarize what I heard, is that, let's say, for example, I am have a case of depression and I'm on some medication for that treatment, but I've been stable and I've been seeing a physician about it. That sounds like that's the kind of thing that you're looking for, is someone who has actually being treated for their condition and is stable.
Absolutely, yes. That is correct.
Great, thank you. Mr. Chevres-True, do you have a question?
Yeah, at what point is the Coast Guard required to step in and evaluate someone who holds a license themselves and then determine whether or not they're fit to sail?
So the office that handles that is called suspension and revocation. And every sector has an investigating officer. And what will happen is, if there's an incident or if there's a concern, then the local company or industry or whoever is the person that has concerns can contact that sector investigating officer. And then they have the authority to investigate the complaint or the whatever they think. They actually have the authority then to sequester medical records, if somebody is drinking. So they have that authority, that enforcement authority. They also work closely with us. So when they do get notified, they will let us know. And we work hand in hand that we can look at, or for example, the first thing I'll ask is, does the person have a waiver? They were caught with, I guess, ADHD medication, so the stimulant medication. And do they have a waiver for that? And we look and it will say either yes, they were very aware that they have that and they have a condition that they're being treated for. Not that that excuses if an incident that happens, but yes, we can tell them that. And if something is found by them to be serious enough that they think that the mariner's medical certificate should be canceled or pulled or put on hold, then we'll work with our lawyer here and determine the right proper way to do that. And usually what we'll do is we'll send the mariner a letter saying, hey, we've been notified by suspension and revocation that you had an incident on this such a date. Please provide additional information from your treating provider. If we don't hear from you in 72 days, we will cancel your medical certificate. Does that answer your question?
Yeah, and then a follow-up for that is hypothetically if someone who holds a credential, say gets it pulled due to some event, is it possible for them to go through the correct treatment and reevaluation and earn their certificate back?
Yes. So there's two parts of credentialing, right? So there's the credential, merchant mariner credential, and there's also the medical certificate. The
Oh, you just bugged out, Dr. Carr. Could you repeat that?
criteria for each separate piece of paper, basically, you know, our medical certificate is that piece of paper.
Dr. TR,
The
just a second. Can you repeat that?
So yeah, yeah, can you hear me? Can you hear me now?
We can now, yeah.
Okay, so the credentialing side of your credential is separate from your medical certificate side. So the piece of paper that you put inside your booklet is the medical certificate. Our criteria for returning you to duty or for, you know, deciding if you need a waiver or if you need to have your medical certificate revoked, the criteria for that is based on what your provider tells us. For the credentialing side, it's more of they have an authority a legal authority that they could send you to court, they can revoke your credential. Their requirements are a lot more and they have maybe a higher standard of returning your credential if there's issues related to your credential. The drug alcohol program, that's on the credentialing side. The program has the serious ramifications, and they're different than drug enforcement. Is that?
So
Are you still there?
Yeah, so just to summarize, drug and alcohol violations are on the credentialing side, whereas medicine, like for ADHD and whatnot, is on the medical side.
That's correct.
Great, awesome, thank you. I was wondering, and this might be hard to answer, but about what percentage of your medical waivers come in, or medical applications come in get medical waivers for mental health?
That's hard to answer because I have the total number of waivers. There's so many different
anything.
Yeah, we can't hear you right now.
Under it. I think when we looked at it a year ago, I want to say maybe 10%.
So about 10%?
It's actually like 4%.
4%. Okay, that's great. That's great.
Yeah.
Great. I'd like to ask some questions from the chat. And the first question is, can any health provider deal with these forms? And I think they're talking about the medical application forms, because they said that my medical provider wouldn't fill out the school student health form.
So the forms, the requirement per the Code of Federal Regulation, any physician.
Oh, unfortunately, we're having a hard time hearing you. Okay. Dr. TR, are you there? Well, this worked earlier today when we did a dry run. Dr. TR, can you hear me? I think she's coming back on. She just left. There she is.
Did you hear any of that? Did you hear any of that I just said?
No, now we can hear you. Try again, please.
Okay. So by law, any physician assistant, or fill out the 719K form.
So they can do it. If a physician says they won't do it, that's just because they're not having a good day.
Yes, correct.
Okay, great. Also, we're getting, as a mariner underway, if you have concerns about a shipmate on your vessel, who should be your first point of contact? The master?
Yes, so whoever on your vessel is responsible for the crew, yes. And again, I'm not familiar with each individual ship, but yes, it would be the person that's responsible for your crew. If that's the master, yes.
Great, okay. Any other questions from the audience? And while we're waiting for some questions, just want to encourage cadets to get mental health care early. It's always best to go talk to a CAPS counselor early before conditions worsen. That's always a good strategy. You know, just as you would with any kind of illness, physical illness, mental illness, it's best to get early intervention. So don't hesitate. Any other questions from the audience? Now's a good time to type it into the chat. But I do have follow-up question for you, Dr. TR. Regarding hospitalization, does hospitalization for a mental illness preclude one from getting a license? Or does that just fall into the category of they need to have not been hospitalized yesterday, you know, and have had some stability since then?
You're correct. Hospitalization does not preclude you. The question is, yes, how are you doing? How has your condition been? Just confirmation that you're, you know, you got proper treatment and you're stable and doing well. That's the criteria.
Okay, great. Got another question. What happens if you have a mental health condition and you freak out on a ship? I mean, I suppose your first point of contact would also be the master for that. But do you have any about that?
So again, it depends on your ship, and I'm not familiar with every ship. So it depends on your ship what your policies are for when something happens and where to get help. Obviously, so the most immediate person or provider that's available to you is the person that would be handling your condition at the time.
Okay, great. Question, this is a long question, so let me read it. Consider the following. Dr. A is my general physician and Dr. B is my psychiatrist. When making my MMC application, I bring my 719K to Dr. A and a letter from Dr. B explaining my mental health condition. Dr. A reads the letter from Dr. B and writes on my 719K that my mental health is managed and that I can send the 719K and the letter and the rest of the MMC form to the Coast Guard. Months later, a rep from the NMC will ask me follow-up questions and then decide if I get my NMC. So I guess that's a question.
Is that about the shape of it? Or am I misunderstanding something along the way? I'm just trying to visualize it.
Yeah, just trying to visualize it. Is that about how it happens?
Yeah, I didn't hear the last part of that. I got the point where you submit your K and your letter, and then what happens?
Well, that's sort of the question. Is that the gist of it? So your physician takes the letter from your psychiatrist and then you submit the whole package. And that's
Yes.
the process. Okay, sounds good. Another question, does the Coast Guard tell companies if you have had any
That's it. That's perfect.
That's perfect. Okay, great. Next question, does the Coast Guard tell companies if you have had any mental health problems, or is this protected by Hipaa?
Right. We do not, we have no responsibility to the companies. When you submit your 719K, you then, if you want us to discuss with the company, or if you have a third party that you
Sorry, we're missing that from you.
the answer is no, we do not share information with companies.
Excellent. So no, Coast Guard will not share information with your company about your mental health conditions. That's a great question. Someone asks, here's a, where can someone get resources for ongoing everyday mental health self-care? I think that would be a great question, actually, for Ian Wallace, who's on the line right now, or for Mira Elwell or Andrea Schneider. Will one of you take that question, please?
Sure, I can start us off. Thanks, Bets. Thank you, Dr. TR. Happy to chime in here just briefly, and my colleagues too. So the CAPS website, www.csum.edu/CAPS, I'll put it in the chat, has a bunch of resources. I'll also put one I use a lot, I refer to students, called the helpguide.org, partnered with Harvard University, and they've got a lot of good information and tips in a concise type of way. So I'll just put those two out there.
I'll also add to that, we're in the process of obtaining a portal called Tau Connect, which is Therapy Assistance Online. And it will have psych ed modules for stress reduction and for a mindfulness library, as well as different ways to engage in self-care when you're stressed out. So it's sort of like you can self-refer and enroll in it as a student, whether or not you're in counseling, but also as an adjunct to counseling. But if you're a student who thinks you might be having some depression or anxiety, we definitely recommend coming into CAPS and get it treated. It's treatable, it's temporary, as long as you get treatment for it. And we want to be preventative, so it doesn't become a bigger situation. So just like you're taking care of your body, take care of your brain health and come in and get some counseling. We're here for you confidentially.
That's great. Anyone else? Mira, do you have any comments on that, or would you like to introduce yourself, Mira, really quickly?
Hi, my name's Mira. I'm the new part-time therapist with CAPS. I work with Andrea and Ian. I don't really have anything to add. I just echo that if you're having any mental health concerns, it can be really good to just come and talk it out with someone and figure out what the best course of action is, whether it's ongoing treatment or just regular check-ins. Yeah, I really encourage it. So come see us.
Fantastic. Thank you. Welcome aboard. Robin Christopher notes that less than 2% of all Cal Maritime medical certificate applications over the past 5 years have been issued a waiver with their medical certificate. Less than 2%. That's a pretty impressive number. Any other questions from the group?
What exactly, how should I be interpreting that 2% number with the Cal Maritime certificates? Because like, would that, because in regards to like medication, does that mean that like they're less likely to give a waiver, meaning that I wouldn't be able to take my pills with me, or would that, or does that mean that Cal Maritime students have tremendously good mental health?
So from our perspective, and I can tell you, I do know how many denials, and I will tell you in the last, I've been here 4 years, we rarely deny applications or mental health conditions that are under control. And we waive medication related to a condition. So we don't waive just the medication. So that would mean then, I would interpret what she just told you is that means that if you're well controlled, regardless of your mental health condition, that you either will get a waiver or you don't even require a waiver. Again, a lot of the conditions, if you're well controlled and stable, you don't even require a waiver. So I think that's good news. That's saying that, you know, take care of your mental health conditions, take the medication that you need. We'd rather have you medicated and healthy than not medicating and unhealthy.
Good morning, everybody. I'll just jump in for a quick second, but I'm really thrilled, Dr. TR, that you're able to address our group. And I'm also thrilled as to how many cadets showed up, as well as faculty and staff, to listen. This is such an important topic. And it's something that I think people are very typically apprehensive at discussing. And I know that in the past, I've had cadets come in to see me, and at first they're very hesitant to even talk about, you know, whatever situation is concerning them. And I want to encourage you to use me as a resource as well. Certainly first referrals would always go to the health and mental health teams that we have in place here at Cal Maritime. But what I'd like to clarify for the question from Joey was that typically the waiver letters accompany folks that have long-term conditions. I'm the mom of a type 1 diabetic, and so type 1 diabetes is typically a condition that needs to be managed. So a waiver letter may be issued as long as the condition remains well controlled. So I think the vast majority of the few waiver letters that we do get pertain to long-term health care condition or health conditions that require ongoing management. So I don't want you to think that the waiver letters are pertaining to mental health, because for the most part they are not.
That's great. Thank you very much, Robin. I really appreciate that clarification. I think another thing to keep in mind, Dr. TR too, is that, you know, honesty is the best policy. When you're filling out your 719K, put your mental health drugs down, put your mental health issues on there, because you don't want to be found to be in violation of that rule at a later date, because could that affect your credentialing if you're found to not be honest about that? Oh, well, I think we don't have you. We haven't heard any of that.
So
there you go.
Yeah. So the answer is, from our perspective, all we care about is that you're being taken care of. And so when somebody neglects to put medication information and we find out, we'll say, oh, clearly you forgot. Can you tell us what's going on with this medication? It's not punitive. We're not punitive on our medical side.
Okay, that's great to hear. We're not punitive on the medical side. Very good. There's one more question. Is the school required to report anything they learn about a cadet's mental health? Dr. TR, do you know if the Coast Guard requires the school to report?
No, there is no requirement for a school to report. That's nowhere in the regulation, no.
Excellent. And can I ask, Andrea, does the school report anything to the Coast Guard?
Not to my knowledge. It would be a Hipaa violation if we did. So, you know, and I'm sure my predecessor, Ian, has more info about that, but I've never done that.
Thank you, Andrea. Actually, I want to pass this question over to our nurse practitioner, Heather Hutchinson, who assists cadets in completing some of the information that gets shared with the Coast Guard. Heather, if you wanted to chime in on this question.
Sure. Can you hear me?
Yes.
Yeah. So, you know, we will, if someone has depression or a mental health problem that they take medication for, it will often be documented, and typically it's documented as, you know, managed either with counseling or with medications and counseling. And then we'll just document that the condition is stable and that the person has no limitations. And it's actually very common. And so now we don't disclose any specifics about the person's counseling or private conversations they have about their mental health. It's typically just the problem, the treatment, and the stability of the condition. And so it's very limited. And so that's basically what we do with any condition that a cadet has. So.
Excellent. Thank you, Heather. Any last questions for Dr. TR? It looks like that might be it. Dr. TR, I want to thank you so much for coming to talk to us today. You've cleared up a lot of misperceptions and misunderstandings, and this process now seems really clear and straightforward. You know, sort of makes me think that there's a lot of hope out there for people to get some mental health care here at Cal Maritime without worrying about Coast Guard licensing issues. So thank you very much for joining us today.
You are most welcome. It was my pleasure. Thank you. Take care.
All right, thank you. And I want to let everyone else know that we will make the slides available and the recording available at a later date, like tomorrow. But I want to thank everyone who showed up and everyone who participated. Again, keep your eyes out for the next 3 events in this 4-part series. And we will on mental health and well-being here at Cal Maritime. And thank you for showing up. Have a great day. Be safe and be kind.
Thank you. You too.
Thanks, Bets.
Thanks for hosting, Bets.
That was really great. Thanks, you guys.
Thank
Cheers.
you, Bess. This is really important info. Thank you.
Thank you.